Dr. Cass, we've been working together on Total Health Magazine and a number of other things for, 10 years now probably. And you do have an active practice, even though you travel and you lecture and you write books. Can you give me an idea of how someone goes about treating addiction?
You know, addiction has been treated kind of as a stepchild of psychiatry. And people look on addicts as being weak, poor moral character, if they would just, get it together, use self-control. And I have to say, in a way, the 12-step programs kind of feed into that. And at the same time, I have to say I do appreciate AA and the other 12-step programs because they really do help people have a support structure. I think that's extremely important. But what they've missed is that there's a biochemical component to addiction. Now, Bill W. knew that. He had contact with Abram Hoffer. And Abram Hoffer had told him about what's called orthomolecular psychiatry, that is using nutrients. So he was onto it. Bill W. was onto it, but AA never adopted that. So you go to an AA meeting, and so I hear, because I haven't actually been to one, but I know people are smoking, drinking coffee, eating cake and cookies, all the bad stuff, right?
That's right.
Why? Not because they're bad people or stupid or weak, but because their brain chemistry is out of whack. So the very same things that they're turning to now, the sugar, the caffeine, the whatever it is that they're using, the cigarettes, are to raise their dopamine level. And that's the reason why they had their addiction in the first place, because their dopamine level and their other brain chemicals were out of balance. So if you can help someone rearrange their neurotransmitters and replenish the deficiencies, the cravings are going to go away. And that's just what I do. When I'm seeing patients and they're addicted, I'll give them tyrosine, phenylalanine, glutamine. Those are my favorites in terms of amino acids for treating these situations. There's also an herb called kudzu, Kudzu, that really does help to metabolize alcohol and to stop the alcohol cravings. And what I even developed, what happened was, out of self-defense, I actually developed a set of products, a Brain Recovery AM and Brain Recovery PM, because people in recovery, when they're dealing with addiction, it's really hard for them to figure out how to count their pills and I take this in the morning and then I take one of these and three of these, and they get confused because they don't have their full brain function. So I made it very simple. I have a morning packet, take a packet with breakfast, a packet with dinner, and there are multivitamins in both. There's fish oil in both because you need the essential fatty acids for your brain. There's amino acids in both, and there's blood sugar balancing products in both. So when you've taken the 2 packets, what you've done is helped to rebalance your brain chemistry so that the cravings are going to go away, and you can start. I had one guy, this was such a good story, who he actually wasn't even a patient. I said, I just developed these products. I'd like you to try them, because I knew he was in recovery. He was about 6 months sober from a meth habit, and he was at a lecture I gave. I said, why don't you try these? He said, I'm sober, I'm fine, I don't need them. I said, do me a favor, humor me, try them. Called me 2 days later, he said, I can't believe it. I'm dreaming. I'm remembering things. And within a week or two, he was writing letters to get a new job. And here he was sober already. He was not, he wasn't using, but he hadn't quite gotten it together to get the kind of job he wanted or to live the life he wanted. And it really helped pull him out and go the next step to getting his life together. So that's what happens when your brain is really working on all cylinders. And when someone's addicted, they're not a bad, weak person. They are deficient. And if we can give them what they need, and very often they're low blood sugar as well, so they have to make sure to eat the appropriate, probably 3 to 5 meals a day, make sure they have enough chromium and enough glutamine to help balance their blood sugar, and to eat good, healthful foods. Stay away from the bad stuff, because that's only going to perpetuate the addiction cycle. And if you eat well, that goes a long way toward even mitigating the cravings and to restoring your brain chemistry to where it should be.
So basically what you're saying is you need to go a lot further than just belonging to an organization where you are there with a number of other people who are fighting the same problem.
Right.
You need the help to be able to hopefully overcome the craving and these other things that are really very prevalent, but are replaced by the coffee and things like that.
The coffee and donuts. And I would love to speak at AA programs. I think they've done a fabulous job. in taking people in, giving them support, having sponsors. And I've seen the really positive effect that this one piece would be so important, so vital to introduce the role of nutrition, of eating properly, taking out the bad stuff and adding in the good stuff, like my brain recovery packets or anything like it. Just look at the ingredients and get an equivalent somewhere. And that's all on my website. In Natural Highs, I talk about brain chemistry, and I have one chapter that I really like. I loved writing it, called Addicted, I Can Quit Whenever I Want to. Because people, when they're addicted, really think, I'm in control. They're not. But I explain what's really going on, where that craving is coming from, and how you can really conquer it very easily, and you don't have to do it with willpower, you do it with nutrition.
Natural Highs is a terrific book. I recommend it as well. Well, we all know someone, either someone we love or someone who is close to us or close to someone we care about that has these problems, and I recommend that you let them take a look at this video or that you help them seek help. Thank you.
Thanks.